Welcome to The Hidden Load, the podcast where we uncover the unseen weight carried by the educators and leaders in medicine and explore how to lighten it. I am Dr. Santina or Tina Wheat. I am a family physician, an educator, a leader, and a coach. Each week, we will dig into the challenges that often go unspoken, from burnout and boundaries to purpose and identity to figuring out sustainability, and share practical tools to help you move from chaos to calm and from burnout to balance. Because the hidden load does not have to be yours to carry alone, and in fact, shouldn't be. Let's get started. Well, welcome back to the next episode of The Hidden Load, Asking for Help. Today, we are going to talk a little bit about employee assistance programs. And to do that, we are bringing in our very first guest. Let's get to it. Today, I am honored to welcome to the podcast Mary Ramon. As a licensed counselor, clinical coach, and certified employee assistance professional, Mary specializes in physician effectiveness and well-being. She has spent 14 years managing the employee assistance programs at 2 academic medical centers. For 9 years, she has coached physicians through professional roles and private practice, learning from their challenges and the thoughtful ways that they navigate them. Mary, I want to start by sharing gratitude for the fact that you have supported so many in both employee assistance programs and as a coach. It can be so hard for folks to ask for help, and so I am so glad that you're doing this. Even though so many have access to employee assistance programs, it has been my experience that many do not always know that they even exist. And even if they do exist, they don't know what they do. So thank you so much for joining us.
Thank you for having me on the show. This is wonderful, Dr. Wheat, and it's an honor to help people who help others. So I love being a helper to sort of has a ripple effect when you're helping leaders and physicians and instructors and learners. So yeah, total ripple effect, and it's an honor. And I'm happy to talk about EAPs, employee assistance programs, at any time.
Yeah, let's start there. Do you mind sharing a little bit about what EAPs are and what support gets provided?
Definitely. EAP stands for Employee Assistance Program. It is a free, voluntary, confidential program for employees and quite often their immediate family members. It's usually staffed by licensed counselors, and we help with work-related problems and personal concerns. And the thing that really I like to emphasize is confidentiality, because people will get a little bit nervous. It's like employer-based program, and then they think you're going to talk to their employer, but it is HIPAA compliant. They don't diagnose and treat, but it really helps people to have additional support outside of work. And I wish more people knew about them, and I wish we could also just destigmatize the idea of asking for help.
That confidentiality is so important. Are there types of things that you find yourself helping physicians with?
And so many things. Yeah. Obviously, burnout is big, right? I also help them with communication skills, really just being the most effective in the environment that they're in. As you know, every physician is different, but they have common themes. And so I help them, I meet them where they're at and help them with those common themes. But I think physicians are some of the most important members of society, and we need to act with some urgency in supporting physicians, because they're also we don't have enough of them. We have a physician shortage, and it's a very demanding profession, and we have people dropping out of the field. We have a high rate of suicide compared to other professions. So it's so important that they get the support and help, and we break down those barriers and walls that, physicians are, we're taught to be sort of invincible and always
Mhm.
put on a smile and be made of steel. And we have to really change that narrative.
Early on in my career, I distinctly remember this day when we were in a leadership meeting, and one of the senior midwives on our team shared a story about how she'd had a delivery really go wrong and reached out to our EAP, and how that was a an amazing opportunity for her to really just have this opportunity to talk through something that is a common experience that is faced by so many, but she didn't feel like she could turn to her peers necessarily because she was early on in her career and didn't feel like that was something that I don't know that she didn't wanna own up to the shame that went along with having a bad outcome, but it was just such an eye opener to me about how common that feeling was.
Yeah.
And I loved that she was so open with sharing it because it was in a room of leaders, and she was saying, "Hey guys, just remember that your direct reports need to know that this exists. They need to know that this is available, not just when the bad things happen, but before the bad things happen so that they know when to turn because they're scared to come to us when the bad things happen."
Yeah, I'm so glad you mentioned that. And yes, EAP should be used ideally proactively, but also absolutely when bad things happen. And we responded as an EAP to a similar case where there was an unexpected infant death. And
Mm.
so that's the type of thing that an employee assistance program can help with. Um, Sometimes uh, what do you call it? It's called different things, but the review that
Mhm.
happens an incident, is it called, sentinel event
Yeah, I've
response?
seen it called a Sentinel case review. I've
Yeah,
seen just like
yeah.
the root cause
Okay.
analysis, different
Yeah,
ones at
root cause
different
analysis,
organizations.
all this,
Yes.
yeah, MMR, all these different things. But, sometimes depending on how it's held, it becomes more of a pointing fingers, which
Yes.
this group of nurses, NICU nurses, they were already devastated, and then it
Mhm.
became a finger pointing thing on top of that. So, we were there to support them. You know, there's so much celebration when there's a birth, but there's nothing in place to support people when there's a death,
Mhm.
or an unexpected outcome. And that's in life and at hospitals and academic medical centers, right? And
Right.
so my thought is, people are born in hospitals and they die in hospitals. And it
Mhm.
shouldn't just be, let's just move on to the next case without some sort of something in place to support the caregivers.
Absolutely. As you have supported clinicians, whether they be physicians or other clinicians, have you had anything that surprised you? Have you been surprised by any themes in this role?
I guess I've been most surprised by how common the struggles are and
Hmm.
how so many people feel like they're the only one feeling this way.
Yeah.
And they do get some relief when they hear, I hear that a lot. You're not alone in that. Actually,
Hmm.
most people feel that way and they're just not talking about it. And then you start to see a shift when that's acknowledged. So everyone's carrying a hidden load.
It's absolutely so isolating, and just having that validation can really change everything.
Yeah. Yeah.
So when I say the hidden load, I describe it as the things that you are carrying that no one outside of you or outside of your role truly sees.
Yeah.
What's something that you consider to be part of your hidden load that you don't mind sharing?
Absolutely. Everybody has a hidden load. My hidden load, I don't post about it on LinkedIn because I feel like I am a coach. I need to have my act together and I need to shine the light for other people, right?
Mhm.
But I'm also a person. I'm a single mother. I'm divorced. Um, and I work full time and I don't have any backup.
Mhm.
And so I'd say that's a hidden load.
That is tough. Have you
Yeah,
found things that have helped you, or found strategies that have allowed you to get through this? Or found
definitely.
strategies that haven't worked?
What hasn't worked is okay, I pride myself in being independent. I'm not an island, and so I needed to learn the difference between independence and interdependence, which is I'm such a helper and I have a hard
Mhm.
time asking for help. So I'm getting better at it. Um, just if I have an emergency or whatever it is, just I have wonderful friends and
Mhm.
people who will step up, and I just have
Mhm.
to not shy away from asking for help. So that I'd say that's the biggest thing that didn't work, but is now working better. And aside from that, I've set things up so that I have a fairly flexible job. I
That's nice.
work from home, and
Mhm,
if anything were to happen, I could just go to school or the doctor or whatever. I can drop everything. Um,
mhm.
and that helps with late start days and it helps with all those things. I don't know how people do it. I am envious in a good way of my friends who have a two-parent household. I not envious, like, it's not like I don't want that for them. I'm just
Mhm.
like, I would love to have an extra set of hands, an extra car right now. Just
Mhm.
somebody could go do this errand while I'm doing this, that sort of thing. So
Yeah.
I'm not complaining. I rarely do, but I thank you for asking because we're all human.
Absolutely. I really feel the not asking for help, that has been one of my, that has been one of the struggles that I have had to work through myself.
Mhm.
When, my mom was very sick and when she had her stroke ultimately, um, I would have never thought to ask for help even when she had her final stroke. And my husband came to be with me at the hospital.
Mm.
And he called our neighbors and he asked them to come and sit with our kids. And it was such an obvious phone call to make.
Right.
Our kids play together all of the time. We hang out all of the time, but it never would have crossed my mind. Like it was not something that was part of my brain. And he just called our neighbor and the husband just sort of walked over and sat in our house until we got home because our kids were not old enough to be in the house by themselves at that time.
Mm.
And I just remember being like dumbfounded that he would call and ask for help because that just was not something that I did. It was not part of my
Yeah.
behavior. And
Yeah.
ever since then, it still took me a while to learn how to do it, but
Mhm.
ever since then, I've had to learn step by step that I could ask people for things. It I have to remind myself that I created a village for a reason and that I could ask for help when I needed it.
Yeah. Kindred spirits, and
Yes.
we have to model and practice what we preach, right?
Yes.
Because it's so easy for me to tell other people, rely on your support system, ask for help,
Ask
but
for
then
help.
we have to model that. So it's good that we're both getting better at that.
Yes. And it's hard at home because I feel like I have to be the super mom for my kids. And then recently I had this, my girls are now 10 and 13. And so I've started to teach them, well, mom can't do everything. So this is why mom started to teach you how to do things so that when mom and dad are traveling, you have to learn how to do your laundry so that you can get
Right.
things done too. You have to be part of the help and the solution to make this all work. It's there, but then when I can do that at home, it feels easier to do it at work too. And it allows all of it to be a little bit more
Right.
harmony.
Right. I'm glad you mentioned that. I have to remember to ask my boys for help because they're old enough. Yeah.
They are. It gets there. But
Yeah.
like little steps, step by step, we've gotten there.
Yeah. Yeah.
So tell me a little bit about when you had done your work with the academic centers. Were there any additional things that you saw, any additional hidden loads that were specific to the educators or the academicians or the leaders that you were
Mhm.
watching them experience?
Yeah. Yeah. I think that leaders are in a tough spot because they're responsible for the bottom line. They're
Hmm.
responsible for change management. They're responsible for, I don't know, if the joint commission comes or all those things, right?
Hmm.
And they also are parents or, they have their own lives, but they can't just drop everything. So they have a lot of pressure coming from a lot of different directions, above them, below
Hmm.
them, and around them. And educators also, I mean, they're being evaluated by the people they're educating. They also have research that they
Hmm.
need to do and possibly a clinical load and a hidden load outside of work, right? So, uh, yeah, it's a lot. And in doing EAP work, we didn't just serve individuals, we served the organization. So,
Hmm.
yeah, the organization was our client. So I got to kind of learn all about it.
And were there things that you noticed as trends that you wish they were doing differently or that you were, I don't know, supporting the organization in making changes for to support their individuals better?
I'd say one example would be for change management.
Mhm.
There are stages of change, and they're
Yes.
similar to the stages of grief.
Yes.
And what's interesting is that leaders often know about the change before it's rolled out. And they've gone through the stages already. So they're maybe in the
Mhm.
acceptance stage, and then they roll it out and they're like, well, why are people pushing back? Well, there's the shock,
Mhm.
anger, denial, sadness,
Mhm.
whatever, resistance before you get to the acceptance. So it's not that they're doing it wrong, but that was an opportunity to kind of help them see, um, you've known about this longer, and people maybe just be a little bit patient and more patient,
Mhm.
and expect that people are going to be at a different stage and they're going to need time to adjust, so that's one
That's one
example.
example.
Now if you think, I mean, if we could talk forever about what changes could be made in healthcare,
Mhm.
to more sustainable for the people in healthcare, that's a larger topic, but one that I have some thoughts on as well.
I think it's interesting that you mention, the leaders often knowing about the changes before it comes. I also feel like the leaders often have to process that and go through all of that, sometimes alone too,
Yeah,
and
good
hold
point.
that grief process on their own and do that in a silo.
That's a good point, and that's a very compassionate way of looking at it. They go through their own grief, and they don't have support, and they don't have anyone walking them through it, and yeah, it's not easy to be at the top. It could be lonely at the top, as they say.
It is, and then you have to do that with the smiling face, and or maybe not the smiling face, but you have to do it with the without sharing how you're feeling on the inside because no one knows at the same.
Yeah, yeah. You have to help everybody with how they're feeling and not
Right.
not show the burnout, not show the emotion, because it's about being professional, right?
Mhm,
How do we balance professionalism with being human, And
mhm.
sometimes I think it's okay for leaders to open up and say, you know what, this is hard, right? It's been hard
Yeah,
knowing about this and not sharing it with you and just kind of, show your humanity. Easier said than done. But
it is, it absolutely is.
yeah.
And you've been supporting folks through EAPs and as a physician coach for a while. Are there things that you have learned, over time that you wish you would have known earlier in your practice of doing this?
Really back to what we were talking about, that everyone carries a hidden load and
Mhm,
it's heavy, and um, people are reluctant to ask for help.
mhm,
And I've noticed that I'm not so worried about the people who ask for help. I'm
mhm.
worried about the ones who don't,
Sure.
So when I give, let's say, a new resident orientation, I'll
Mhm,
tell the residents, hey, it's hard. It's going to be hard for all of you. And some of you are going to be walking around acting like you're fine. And some people are going to think they're the only ones that are feeling like this is really hard. Um, a- and the ones who are most successful are the ones who admit that it's hard and ask questions and use supportive resources. And when I say that, they
mhm,
start taking notes because they want to do a really good job, and be successful. So they're writing it down.
mhm.
But I believe that to be true.
Are there things that you wish that the listeners wish others knew they weren't alone? Oh, are there things that you wish the people listening knew that they weren't alone in facing?
So many things. We could start with imposter syndrome.
Mhm,
A lot of people feel like they're not good enough, they don't belong, that everybody knows more than they do, that sort of thing. Oh my gosh, there's so many. It's usually the most competent people who
mhm,
watch themselves, you know?
mhm.
Um, a- and again, I'm more concerned sometimes with the people who are overly confident,
Sure.
who, especially physicians, or the learners, if they're in over their heads,
Mhm,
to say, oh, I've never faced this before. I think I need someone to help me with this. I
Hmm.
think it makes them safer, and so
Absolutely.
it's totally normal to feel as a learner,
Hmm.
especially. That's why you're a learner.
Hmm.
Um, so you're not alone. And yeah, again, it's just better to ask and to know your technical limitations and seek support. And I only hope that they work in an environment where that's encouraged.
And then probably as the people that are teaching them, that it's okay for them to not know too, that the
Yeah,
educators have, like, we have our limits also. It's okay for us to ask for help because there's going to be those things that have either changed in medicine or are the procedures that we didn't do. That there's always going to be those things that we still need to figure out.
right. It's okay as an educator to say, I don't know.
Hmm.
Let me look into that and get back to you.
Hmm.
Right? Right. People
Absolutely.
aren't used to that, but it's authentic, and I've found or I'll throw out a question if I'm leading a discussion, I'll be like, "I haven't encountered that. Has anyone else encountered that?" And I'll throw it back out,
Yes,
because we can learn from the learners too, right? Or from the people
absolutely.
in the audience. But if we absolutely don't know something, go look it up, find out, talk to people, and then email everyone with an answer. We don't have to be performing. We don't have to be perfect. Nobody's perfect. Nobody knows everything.
Absolutely. Okay, I skipped over this just a little bit, primarily because I knew I was going to come back to it later. But are there system changes that you think that we should be advocating for on an individual level, that are maybe small things that we can do to help lighten the hidden load?
Well, I think about healthcare reform when you ask
Mhm.
that question.
Sure.
Um, and so I think in order for medicine to be more sustainable, to prevent burnout, to prevent people from dropping out, to attract and retain talent, we need to really we need to put purpose over profit.
Hmm.
And really, I think there needs to be less focus on our use. I understand money matters, but right now, physicians and healthcare professionals are expected to do more with less, and the unsustainable number of hours that they're required to work needs to change. And also, one thing that is changing that's a positive is physicians in many states, up until very recently, were required to report to their licensure boards if they had ever spoken with a counselor. And that prevented them from seeking help. And this has changed in about 40 states, which I'm so happy to hear about. I think that's a big one because
Yeah.
we don't want to deter people from asking for help, especially in such an important role where there is a high rate of burnout and suicide. And so that absolutely needs to change. The culture needs to, and there needs to be less lip service paid to burnout. The the burden for preventing burnout should not be on the individual. It should be the organization setting things up differently. And I realize that requires a complete overhaul. Um, and I'm not an organizational expert, but that's just kind of my feeling from everyone I've worked with. That instead of talking about, we brought snacks or go take
Right.
this meditation class, which is nice. It's like, how can we prevent it with some real strategies and give people some time off and some flexibility and that sort of thing. Don't expect 80-hour work weeks and 50 patients a day and that sort of thing. Yeah.
Absolutely. And I will add to your statement about the licensing board and the seeking support from a counselor, and I will add the medication because that has been asked at times too. That even when it's not on the licensing board questioning, sometimes it's on the credentialing boards questions for the hospitals too. So I would love to see all of that go away. I am right there with you on all of the things that you said.
Yeah. That's one of the reasons actually why, even though I'm a licensed counselor, I
Hmm.
offer coaching as an option for physicians because there's no diagnosis and there's no paper trail. and they don't have to go through their insurance. And so
Mhm.
anything we can do to eliminate barriers, I'm a big advocate for.
Thank you so much for that. And so that is a great segue into how can people find you, Mary?
Oh, thank you for asking. Well, you'd have to be able to spell my name to find me. So it's my website is maryramon.com. Mary is easy, but Ramon is REMON.com. And you can just find me there. It would be my pleasure. I do offer complimentary consultations to see if it's a good fit. And I find tremendous value in helping people who help others. So it would be an honor.
Great. And we will tag Mary in the show notes as well. And so thank you so much for joining us today as we talked about how you can reach out and ask for help. Thank you for joining us again today on The Hidden Load.
Thank you, Dr. Wheat.
Thanks for joining me on The Hidden Load. Tag me on Instagram at Dr. Tina Wheat or email me at santina@santinawheat.com with your takeaways and ideas. Don't forget to subscribe. And until next time, let's lighten your hidden load.